Which one do you want to start with, Erin?
It doesn't matter to me if you want to start with Delegate McComas, since she's here.
Okay.
She could.
All right, wonderful. So good afternoon. It is almost noon. We just got off the floor. This is the meeting for the Health and Government Operations, Public Health and Minority Health Disparity Subcommittee. Welcome to our members and to the sponsors of some of the bills and the advocates. We have a very open process here, so anyone can attend them. Before the meeting start, our wonderful, amazing lawyer, counsel, Erin Hopwood sends the agenda to everyone, and you received it before you came here and you know what we'll be discussing. So today we have House Bill 598, House Bill 643, House Bill 689, and House Bill 812. I want to thank Delegate McComas, who I spoke to last week, to invite her to come since we're going to be starting with her bill, House Bill 689, Certificate for Involuntary Admission, Licensed Certified Social Worker Clinical. Welcome to our subcommittee, Delegate McComas. We're going to have our ACO counsel is going to start by telling us what the bill is about. Then I will ask you if you have anything else to add. Then I will open it, as I always do, to the committee if they have any questions of concern. Okay, so Erin, will you be so kind and get us started?
So this bill authorizes a licensed certified social worker clinical in conjunction with a physician to certify an individual for involuntary admission to a facility or a Veterans Administration hospital. There were amendments that the bill has passed the Senate, the cross-file has passed the Senate in the version that has been provided for you, a reprint version of the bill. The amendments would pull in current law that authorizes a parent to apply for admission of a minor child. So in those provisions, it's the signatory requirements. These amendments would pull in the certified social worker. And then throughout the bill, the amendments would pull in a licensed clinical professional counselor in the same way that the bill as introduced included a certified social worker clinical.
As I review the bill, I see that the supported stakeholders for the committee members, the University of Maryland School of Social Work, the Maryland Clinical Social Work Coalition, the Maryland Chapter of National Association of Social Workers, Greater Washington Society for Clinical Social Work, Maryland Board of Social Work Examiners. Social workers provide most of the behavioral health services in Maryland. They are the main force helping people who struggle with severe mental illness. They're often the primary care provider and the main personal contact in the medical field for this population. It logically follows that these workers are in a strong position to certify people for involuntary admissions, along with physicians. That is what I gather from the hearing that we got, okay? Delegate McComas, what would you like to add?
Just that the bill in the posture that was passed by the Senate was what the Mr. Flack intended, particularly wanted to make sure that the minor part of it for the minors got in. And we have no objection to adding the licensed clinical professional counselors. And after having a chance to talk to Ms. Faulkner, I'm very good with it because it sounds like they have comparable experience and training. And I know that Mr. Flack, privately, he told me that several times he stayed in the hospital for like 11 hours before the poor person could see a physician. So he's very dedicated to his profession, which is the licensed clinical social worker C. But he's worked very hard on this bill, and I would hope that the committee would pass it in the form that it passed out of the Senate, because it was the intent when Senator West and I worked on it that they were to be in sync. And so we didn't want any wobbles. We don't want any conference committees. This is kind of a good bill for the public and a good bill for the professionals to just, get it done.
And also there's an AG opinion in the bill, in the file, and it says that it is my view that a licensed clinical social worker may provide diagnostic testimony with respect to mental disorder and psychosocial conditions. This would generally mean that they may testify on issues of sanity and competence to stand trial and in other situations where a personal mental condition is at issue. And that came from Delegate Rosenberg. We do have, if you look at the witnesses in the bill, there's no one that testify against it. We do have Rachel present here who would like to be heard on this bill. Welcome to our committee. What can you tell us?
I thank you, Delegate Peña-Melnick and members of the
My
subcommittee.
pleasure.
I would just add really two things. This very much intersects when we hear in the House and Government Operations Committee, people sitting in emergency departments for hours on end because an involuntary admission requires 2 signatures. It's oftentimes that second signature that is hard to get. And so this, the goal really is to shorten the time period that somebody is languishing in an emergency department seeking treatment when they have a mental illness. And I would just like to reiterate what Aaron and Delegate McComas said about the licensed clinical professional counselors. They very much have a comparable education training among their clinical licenses. And so we would add, we would like them to be included in the bill for minors and adults.
Thank you. And the amendments do that as they pass the Senate, correct?
Correct.
Yes.
Okay. This is the portion where I asked the subcommittee members here in the subcommittee, do you have any questions? This is where if you have concerns, you bring them up here. This is where if you have questions, you bring them up here. So are there any questions or concerns regarding House Bill 689? Any questions that you may have? You have the primary sponsor of the bill here, you have the counsel of the bill here, you have an advocate. Are there any questions or concerns that you have for these 3 individuals or for myself? I welcome it. This is the time to do it. We want a good bill. We want a good product on the floor. Any questions or concerns? Seeing none. Are there any, may I have a motion on the bill then?
Move the amendments.
It's been moved of the amendments. That's correct. May I
Second.
have a motion on the
Second.
amendments, please?
Move the
So
amendments.
moved.
It's been moved in second. Are there any questions or concerns you have about the amendments that have just been moved on House Bill 689? Seeing none, on the bill as amended, may I have a motion?
Move the bill.
It's been
Second.
moved by Delegate Hill. It's been seconded by Delegate Bagnall. On House Bill 689, that has been moved with amendments. Are there any questions of this committee for this bill? Any discussion? All those in favor say aye.
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 Any opposition, please let me know. Seeing no opposition, the bill passes unanimous. Thank you, Delegate McComas, for coming. Thank you, Rachel. for
Delegate
coming.
Rosenberg has a question.
May I,
Excuse me?
before
Yes.
Delegate McComas departs?
Sure.
Thank you. Mr. Flax is a constituent of mine, and Delegate McComas has been able to get a bill further on his behalf than I ever was. So I just want to commend her for her skill and her advocacy on behalf of not just my constituent, but those who will benefit from this legislation. So thank you, Delegate McComas, and thank you to the committee.
That's very beautiful, very.
Well, Delegate Rosenberg, I think you're way too kind. Mr. Flack worked very, very
Flax.
hard on this. And so he deserves 90% of that credit she just gave me.
Thank you, Delegate
Good for you.
Madam
McComas.
Chair, may I be allowed to leave?
Yes, you may leave and so may Rachel. Thank you for coming. We're moving on to the next bill and thank you for your flexibility, okay?
Well, no, thank you for giving me a second chance.
Absolutely. I called you, you held the phone. We give many chances here, okay?
I know I totally missed that first Zoom. So thank you very much. Thank you.
My pleasure. It's a pleasure. Have a blessed day. So on that bill, they passed unanimous, 689. Now we're going to move to House Bill 598, the Maryland Medical Assistance Program, Applied Behavior Analysis Services Reimbursement. It has been amended, modified. It has been amended. So I will have Aaron go through the bill, tell you what the bill does, what the amendment is. If you have any questions, then you ask me here, okay? Erin.
House Bill 598 prohibits the Department of Health from conditioning reimbursement of applied behavior analysis services provided to Medicaid recipients under the early and periodic screening diagnosis and treatment benefit on the presence or availability of the parent or caregiver in the setting where the services are provided. There has been an amendment added to this bill, and it was provided to you in a reprint form. And the amendment states that the prohibition in the bill would not prohibit the medical assistance program from establishing reasonable standards for the involvement of a parent or caregiver, including requiring notification from the parent or caregiver of their decision not to be present or available when the program provides applied behavioral analysis services to the recipient. The department would be required to adopt regulations in consultation with stakeholders on or before December 1st, 2021 to implement the bill. MDH has seen these amendments and they are okay with the amendments.
So the Maryland Department of Health is okay with the amendment upon review of the witnesses sheet that we have here. I don't see anyone objecting to the bill. The bill, this is actually being done for private insured children already. Are there any questions or concerns regarding House Bill 598 for Erin? I see Delegate Bill Castro, followed by Delegate Chisholm. Delegate Bill Castro, good morning.
Good morning. Thank you, Madam Chair.
My pleasure.
I appreciate the what this bill is trying to do, and I agree with what this bill is trying to do. I am caught up, though, just being a special education teacher myself, FAPE is really important to me, and I am caught up on what was said in the hearing about some individuals needing 40 hours of service and 8 hours a day. And so my concern is, are these ABA services replacing school? If individuals are utilizing 8 hours a day of services, when are we in school? So those are some questions that I would definitely like to get answered. Also, in the letter of information sent by the Maryland Department of Health, they talk about how there could be a shift from school-based ABA services required in an IEP to community-based ABA services. So just trying to see where all those pieces fit together and get some answers to those questions if possible.
Erin?
That would take more time than I could do immediately.
Okay.
We can find that out.
Delegate Bill Castro, will you like to hold the bill to find that out? Is that what you're asking for?
I
My
hate to do it because
understanding
I hate to do it because I do agree with what this bill is trying to do. I just think in good conscience, being a special ed teacher, it's just important to me to do that due diligence and have that understanding, if that's okay.
And I appreciate it. My understanding is that it's not going to change actually Delegate Kelly is here. Delegate Kelly, would you like to address the question? And I appreciate you, Delegate Bill Castro. These are the questions that we welcome right here in the subcommittee right now. And if we wanted to get answers, we will do that. We're not going to rush it till we get the answers, okay?
Thank you.
Kelly.
Sorry, I got in after the question was asked. So if you could just repeat the question, I would appreciate it.
That's okay. So Delegate Kelly, again, I just want to share that I appreciate what the bill is trying to do, and I agree with what the bill is trying to do. Being a special ed teacher, I agree. I support ABA services and know a bit about it, but I do, being a special ed teacher in a public school, I do also very much believe in FAPE, and it's important that we are maintaining FAPE. And I do have concerns about what was listed in the Department of Health's letter with that shift from school-based ABA services, shift from what's required on the IEP to community-based ABA services. So I was wondering if we could have some clarity on what that might look like should this pass. That would be really helpful to me.
Yes, and I think this subcommittee runs a little differently than the others because I see we don't have advocates in the subcommittee, but I can tell you that we did get an answer to that question.
We do have advocates and they're invited, but we don't have any on this one here.
Okay, I thought that Judith was going to be on here and she's not, but I can tell you that I received an answer from her on that question. So hopefully she's trying to get in right now and she can better answer the question.
Give me 1 second, Delegate Kelly. Edith,
Judith or Betty?
see Judith?
There is no one waiting in the room at present. There's no one waiting to get in at present.
Did she get the link?
I know that she received the link. I heard that she
Okay.
was waiting. Let me,
Yeah,
hold on.
because Edith manages the committee and she lets people in immediately. And we do welcome, that's how we operate because it's public health. We welcome advocates.
What's her name? Because there were a couple people waiting while you guys were on the floor.
Judith City, and I'm calling her on.
Yes, she was originally on, and she said she was going to come off and come back on later once you guys got to the floor, off the floor.
Hopefully I can get
Was
her on the phone and she can answer your question without a video, Delegate Belcastro, because I know that it was a little bit confusing, but the MDH testimony was, I don't want to, man, straight to voicemail. Okay, so what she said was that this should in absolutely no way shift the burden to the private healthcare sector from the burden that is on the school system right now, right? They're required under federal law to provide the free and appropriate public education. The difference is that the skills that are needed for functioning in life, there's not complete overlap between the skills that are necessary in a school environment, which is what the education system is responsible for, and the broader set of skills that are necessary to have the highest capability of functioning in life. So that these services are for those other functions. And in fact, maybe 6 or 7 years ago, we passed a bill that required at every IEP meeting, parents get what's called a Parent's Guide to Habilitative Services. And it gives you information on how to access those services that your child, in this case, a child with autism, would need above and beyond what is required by the school system through either private insurance or Medicaid. That's the space where this bill operates.
So that I appreciate that. That was really helpful. I guess the other thing that kind of raised a red flag for me in the hearing was we spoke a lot about how one of the reasons that we don't want parents to be there is because services might be delivered 8 hours a day, 40 hours a week. And so my question is, if that's the case, when is school happening? Because obviously school is still very important, right? When are kids going to school and getting their education?
So with autism treatment, generally speaking, when we're talking about that intensity, that's in age 2, 3, 4, maybe up till age 5. But the sort of way the brain development works, right? They recommend very high intensity treatment in those preschool years. So, they will probably still be in an infants and toddlers program or some other preschool environment. But this is in addition to above and beyond that. By the time we're in the K through 12 education setting, you don't need that level of intense treatment, which is the testimony that we also heard from the parent of teenagers or preteens who testified.
Awesome. I guess the last part is that this has been really helpful. Thank you for going through this with me.
Of course.
The last part is just, we spoke, I believe I heard this in the hearing, that those services can be delivered up to age 20. So if it's just for, do you see why I'm struggling a little bit? Because if these services can be guaranteed up through age 20, we're saying that some people will need these services 40 hours a week. I just, as a teacher,
there's nobody
really
who's age 20 who needs these services 40 hours a week. It's not how ABA works at all. It's okay. Just that, and I know that I think the person who answered the question in the hearing maybe sort of went down a wrong path because they were talking about sort of really wanting to protect the rights of parents who choose homeschooling or choose a different type of education. But the K through 12 education system is, the primary place. As you well know, many parents opt for public education as opposed to private schools for their special needs kids because the public school system does a really great job of meeting children's needs. So again, just really want to reiterate that the critical need for this is in before age 6. That's when kids get the most ABA services. You may continue to get ABA for a few hours a week as you grow older, and certainly continue with those life skills portions of ABA outside of the classroom later in life. But the intensity, the problem that this bill intends to fix is the fact that children in Medicaid who are not yet 6 years old are not getting the quantity of hours that they need because their parents have to work.
Thank you so much. This is really helpful. I appreciate it, Delegate Kelly. And Vice Chair Pena-Melnick, thank you for giving me the time to work through that.
Anytime. This is what we're here, right? We want to know, make sure we know what we're passing, make sure that we all come with different experiences. So I appreciate yours and I value it. So absolutely. Any other concerns from anyone? I see Delegate Riley.
Delegate Riley.
Thank you, Madam Chair.
My pleasure.
First of all, I wanted to start out and to thank Aaron and also Delegate Kelly for working with me on an amendment that I wanted to put on this bill and for actually, addressing it in yours, and that does work. So thank you very much. I appreciate that. But a follow-up to that. So if this amendment is taken and we pass it and then the bill passes, the department cannot take out that section, right? They have to keep that opt-out into their, once they come up with their regulations.
Right, it would be required to be part of their regulations.
So that would be required and they can't on their own take it out. Okay, thank you very much.
Thank you, and thank you for your constructive suggestions. I really appreciate it.
Thanks, thank you.
Are there any other questions or concerns regarding House Bill 598 and its amendment? People feel comfortable with it? Any concerns? Okay, great. Thank
Second.
you. It's been moved in second. Thank you, Delegate Chisholm. Are there any concerns or questions on the amendment as moved? Seeing none on the bill, may I please have a motion?
Moved. Move the bill.
It's been moved. May I
Second.
have a second? It's been moved in second. Are there any questions or concerns about this bill? Seeing none, all those in favor say aye.
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 Any opposition, please let me know now. I see none. Thank you so much. The bill passes as amended, unanimous. Delegate Kelly, thank you for being here. I appreciate it. Delegate Belcastro and Riley, thank you for working with the sponsor and for your questions. They're valuable. Next, we have a blessed day. Next, we have House Bill 643. And
I think
actually,
you might want to wait on that one to.
I'm gonna wait because Delegate Shalega held it. So out of respect for her, I'll wait until she comes. Next, we have House Bill 812, the Maryland Department of Health 211 Maryland Mental Health Services Phone Call Program. And there has been a small amendment that the effective date changed to July 1st, 2021. Erin, will you tell us what the bill does, please, in the amendment?
This bill requires the Department of Health to make recommendations to 211 Maryland regarding the establishment of an opt-in mental health services phone call program that requires a call center to make periodic calls to persons who have opted into the program and attempts to connect those persons with a mental health provider on request. There was an amendment, in addition to the amendment that would move the effective date to July 1st, there was an amendment that would authorize the governor to include in the annual budget bill an appropriation to the department in amount sufficient to carry out the provisions of the bill.
Thank you, Erin. Are there any questions regarding this bill? Delegate Hill,
Thank you.
my pleasure.
So I just wanted to be clear, Aaron, in the amendment that you passed out, I see the part on the last page about the governor may include. I'm still seeing an effective date of October 1st. Are you saying there's an additional
So
amendment?
I noticed an additional amendment, so I emailed that.
Okay, all right, thank you.
Hour.
So we're going to look at they're two separate ones. we
Yes,
have to
correct.
go.
And then if you approve them, we could just merge them.
All right, thank you.
Are there any questions or discussion, Delegate Chisholm?
Thank you, Madam Chair. I just want to make sure I understand. So we're going to this is more for the funding. I understand that, putting it in the budget. But so if somebody were to call in and maybe have some mental instability, we would then require a follow-up call to such person. Is that correct?
If that person opted into the program. If they want to be in such a program, they could sign up and the department or whoever 211 Maryland would call them.
I'm just worried. I'm just trying to think out in the head of real world examples and would it just require us to call them back? Because I know a lot of these people sometimes are struggling. They're not going to answer the phone. They might go into depression. Is it just requiring that, hey, we just call them on a landline or whatever number they called, or are they giving us cell phones, emails, or is it just a landline call back from the Maryland Department of Health because they have opted in through this 211? And I guess my other question is, can somebody else opt them in? I'm just trying to think about these individuals. Obviously, they're struggling with something to call in to begin with. Is this enough? What's the effectiveness of this program and what all is entailed?
So it requires a call center to call an individual who has opted into, that means they have had to take an action to say, I want to be in this program, right? So what it does is requires a call center to make periodic calls to persons who have opted into the program. It's a way to check into the person to say, hi, you know, what's going on. It attempts to connect persons with a mental health provider upon request. You know, if they basically need any help, any connections to any services in the community, then that, you know, person who's calling from the call center, you know, does that. It's the same like when I give my constituent, they call me and I say, call 211 and ask for services. You know, they have a list of services and you give your zip code. It acts as a connector and a check-in for person, for people. And you, once you opt in, then you can be contacted, but you have to opt in into it. I don't know if anyone else would like to be heard on it. Rosenberg, you have to unmute yourself.
Thank you, Madam Chair.
My pleasure.
Is it fair to say that what this bill would accomplish is for those who do choose to opt in, you have more contact with someone who could provide advice and counsel? Won't be perfect, but it would be more advice and counsel and perhaps very helpful intervention that would not otherwise be provided. So this isn't going to cover every circumstance, but it is going to provide assistance to a greater degree than we do now. That would be my point.
Yeah, and if you look at page 2 of the fiscal note, it says under additional comments, 211 Maryland is a private, nonprofit organization that maintains an information and referral service network that is available to Maryland residents via the phone. So they do have extensive list of services in the community. I hope that addresses your question.
Well, and just to point out, Delegate Cullison's testimony, and she has a conflicting subcommittee right now, but she stated that there's a senior call-in program that was passed by the legislature, and it's very similar in format. So there is at least a model in the state to be followed. And then there was also testimony that this is being done in New Jersey and Atlanta. So there are models out there.
I like the idea. I just want to, and almost want to be able to, if it does pass, use it in the same format that Vice Chair Penny Melnick does. That people, I want to be able to tell people, because obviously we all deal with some sort of mental health stresses, what they can do, and if they call 211, what they can expect. So that's all. I was just wanting clarification on it, and I appreciate it.
No, and I appreciate it. And actually that gives me an idea. If it does pass, I will actually, I would like to put it on my newsletter to say, you can now call 211, you can opt in for mental health services. You can also ask them to help you find a provider. So it's a way to give people, I like your question because it's helping me think what I'm going to do if it passes. It's another community, resource. So I appreciate your question. Delegate Riley, you're welcome. Thank you.
Thank you, Madam Chair. It's more of a comment, I guess, more than a question. I really like the concept of this bill, and it kind of reminds me of, I think a way to explain it would be more like if you're an AA and you have that buddy system, and if you're in trouble and you backslide, there's someone you can call, and that, which is a great resource. So when, one of these folks are in dire need, or they're at the moment, most of them know that, I think, at that point. And if there was just someone that they could physically talk to, I think it's a great resource. So thank you.
I think that's an excellent analogy for Erin, who's going to be presenting bills on the floor to use, and the delegation's question too. So it's wonderful. Any other questions regarding the amendment or concerns? Seeing none, may I please have a motion on the amendment?
Move the amendment.
May I have a second, please?
Second.
It's been moved in second. Any questions on the amendment? As amended, may I have a motion, please?
Move the bill as amended.
May I have a second, please? It's been moved in second. Are there any questions regarding House Bill 812, as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition? None, the bill passes unanimous. Thank you so much for a wonderful discussion. So we do come to the end of the bill hearings, which is 6:43, and Delegate Shalega is not here yet. And she held the bill. I know she's doing an interview right now as we speak. So what I'm thinking of doing is if we can take a 10-minute break, please. It is 12:30. We come back at 12:40 and see where she's at, okay? And I thank you for being patient. Maybe you can stretch or get something to eat quickly. Thank you. Just 10 minutes, 12:40, please. It's 12:30. Is Hamilton still asleep, Aaron?
No, but he's being good. He's like,
That's good.
I like, can't see.
Okay, won't say anything.
Are we still live?
Yes, we are. I'm gonna just take my video off
And we
for a
won't talk.
minute and get something to drink.
We're still live, so you can't
Okay.
cut it off once it starts. You have to
Gotcha.
Keep it
Can
going.
I ask a question of staff?
Yes.
Hamilton in the room where it happens?
He is in the room. What was your funny? I can't even remember. You had a great one. Oh, he'll be in the.
Forget. Well, I thought that one was pretty good too. But yes, but thank you. Thank you.
Yeah, he's in the Zoom where it happened.
Hmm.
We'll be back in 9 minutes. It's 12:30.
All right, I'm going to cut you guys off sound wise. Yeah.
Did you defend the state song thing today?
Well, come on in, because this is a little story. In the meeting, so I'm not going to put this on.
Delegate Rosenberg, you have to
Yeah,
mute
that's
yourself.
fine. In committee yesterday.
Delegate Rosenberg, can you
Rosenberg.
mute
she'd asked the
yourself?
librarian to do some
Delegate Rosenberg,
research, so we-
Delegate Rosenberg, can you mute yourself, please? Thank you. Okay, welcome back. It's 12:40. Will you be so kind and put your cameras on? We have one bill left. Thank you so much for your patience. Okay, so I texted Delegate Shalega, and I told her that we were coming back at 12:40 to discuss this one bill that she held, and she said, go without me. She's sorry, she's doing something really important and is not able to be with us. So we're gonna go ahead and call the bill. And Delegate Aaron, will you be so kind and give us a summary again of the bill? And this is actually House Bill 643, and Delegate Palakovich-Cart has been here, very patient. Thank you so much, Delegate, for being here with us. Aaron, will you be so kind and get us started?
So this bill would prohibit a person from manufacturing, selling, delivering, holding, or offering for sale in the state a cosmetic product that contains certain ingredients. And those ingredients are listed in the bill. There's 12 chemicals that are listed in the bill that would be prohibited. There was an amendment added by the sponsor that provides that's the intent of the General Assembly that the act be construed in a manner that is consistent with the prohibition on the presence of these same intentionally added ingredients in cosmetics that has been enacted by the European Union.
Are there any questions for the sponsor? Any questions for Aaron regarding this bill? Any concerns? We have Delegate Riley.
Thank you, Madam Chair. I guess this question would be for the sponsor, because once again, the fiscal note, basically says that we don't know how many businesses in the state of Maryland that currently, manufacture, sell, or whatever these products that contain these chemicals. So I see in the amendment, you've actually, laid out the chemicals, by name. So that's a good thing. So give us a little bit more of an idea. But to be honest with you, I don't know what they are. And I'm hoping I'm not using them. But anyway, do we have just, for the sponsor, do we have, just to give me an idea, since we don't know how many businesses in Maryland, do you have samples of brands that are currently using these items? Because I think there's a letter from you in testimony stating that CVS and Rite Aid, Walgreens, Safana, Amazon, Target, and so on, are not, or, banning some of these. So can you give us some actual examples of what they've banned, like the name of the product and what it was? Was it a salt, bathing salt, or was it a face cream, or was it, a lotion? Because all of that is included in cosmetics, the definition of cosmetic. So just to give me an idea, what were the products we're taking out of commission to be sold or produced. Do you have anything like that?
Yeah, thank you, Delegate, for the good questions. So I mean, I'll preface this by saying that if you'd asked me that question a few years ago, I probably could point to major brands that included these chemicals. But the shift that's already been happening in the industry is that they are moving away from using these chemicals. And part of that's driven by the manufacturers, and part of that has been driven specifically by the retailers that you just mentioned, because big box stores and pharmacies have put out advisories that are available, publicly, that say we will not stock products that contain the following chemicals. And so because of that, there already is a large movement away from the chemicals that are included in this legislation. At this point, I don't think I could point to a major brand name that we would all recognize that still includes these chemicals. It tends to be much smaller manufacturers, especially manufacturers from overseas, from in China, who are selling their products through the internet. And that is probably the main way that Marylanders might be buying products that have these chemicals at this point. It is unlikely that they're going to go into a store and find a product on the shelf right now that has any of these chemicals in it.
Okay, so that kind of brings me up to a follow-up. So I'm not sure that the bill is even necessary at this point. Second point, this bill wouldn't stop somebody going on the internet to purchase it on their own, would it?
The bill does say that products can't be sold in Maryland as well. So it pertains to the manufacturer as well as the sale in the state.
So then I guess you're gonna have local law enforcement to knock on somebody's door if they find out that they bought a product over the internet and then had this chemical in it. I just see.
There's no penalties for anyone who'd be buying the product. It's on
Mhm.
retailer and the manufacturers that they need to stop manufacturing them if they're manufacturing in the state of Maryland. Again, we have no evidence that anyone is on the manufacture piece, but the sale piece, those online vendors would not be able to sell those products into Maryland.
And there's a letter from the committee, from the Personal Care Products Council. They are the leading national trade association that represent the global cosmetic and personal care product industry. Over 600 companies manufacture, distributed, and supply. And they actually wrote a favorable letter requesting this bill so that they can be aligned with the other states as they're coming down the line. And that's
Right.
in our file.
Right, I did see that. And currently we have California is the one that, is there any other states on this one that passed?
California
legislation?
passed it last year.
Okay,
Okay.
okay. Thank you, Madam Chair.
My pleasure. Delegate
Thank you,
Chisholm.
Delegate.
Thank you, Madam Chair, and thank you for bringing the bill. I think I'm on the same page as Delegate Riley. I don't know if this bill is going to be effective. I agree that it's almost become very, very popular to go away from these things. People seek out these products that do not do any harm in testing to animals, and that's great. I think this is a federal issue, to be honest with you. And the reason that you're getting letters in support from the industry in the United States is they don't want the products coming from overseas, from China. I just don't know that you're going to be able to regulate that without the federal government in some sort of tariff or free trade act from stopping Chinese products that may contain these. My other concern is, even though I don't think we have any manufacturers making, this is a very long list of components and ingredients, and it said any component thereof, meaning chemicals get broken down into very small pieces as well. I just fear that we're going to put somebody in violation that has no intention of being in violation. And I know that that speaks to that. I just don't, I have a hard time believing this bill is really going to accomplish your goal. I think the goal is being accomplished in the free market now by people choosing the option of, hey, I'd like to have this product where I know that no animals were harmed in the production or manufacturing of it. And to just think that we're going to mandate this on Maryland, maybe I'm wrong, but I just don't think it's going to have the effect that your bill intends to have.
Madam Chair, may I respond to that, please?
Absolutely.
Yeah, and just to clarify, this legislation, that's a separate bill about the testing on animals. My bill is only specific to 12 harmful chemicals that are included in it. So I just wanted to make sure that those two bills aren't being conflated here. We do include language in the legislation that basically has a hold harmless provision that says that a person is not in violation if the person manufactures, sells, delivers, holds, or holds or offers for sale in the state a cosmetic product that was manufactured through a process intended to comply with this section or contains a technically unavoidable trace quantity of an ingredient. I mean, that language was is part of the reason why industry is supporting this. They don't have concerns about what you just mentioned about things, unintentionally getting broken down through the process. They're clear about what the chemical processes are that they use in their manufacturing process. They have no issues and are supportive of the bill as written and with the amendment, especially that has been offered to the committee. So
I was just reading
that out there.
Thank you. The physical note goes, as an ingredient is any single chemical entity or mixture used as a component of manufacturing a cosmetic product and does not include any incidental ingredients. So I understand that. I worry about the language, and then a cosmetic to mean any substance or any component. And then are we making this so broad sweeping and trying to rectify a problem and then capturing so many other components and so many other, I guess, manufacturers with no ill will? I always worry about the unintended consequences of these things, and it's so broad sweeping. I appreciate your intent, I really do, but I have deep concerns about the final product and the intent that it brings upon, or the unintended consequences it brings upon.
Madam Chair.
Yeah, and there's no fines in the bill, and there's a whole harmless clause in the bill for that exact reason. We have, thank you, Delegate. Delegate Riley, followed by Delegate Hill, followed by Delegate Bagno. Oh, and Delegate Aaron.
Thank you, Madam Chair. Yeah, I was just thinking of something else. Do these chemicals that are shown here, are these currently on labels of these products? Are they listed?
Yeah, they
as
likely
ingredients?
would be. The one exception of when they would not be listed as a standalone chemical is if they are included in fragrance. Fragrance is considered a proprietary product, and a manufacturer under federal law does not have to disclose what is in fragrance in their item. So if that might be the case where it could be in a package where someone wouldn't know, but otherwise, my understanding is that only applies to maybe one or two of the chemicals in the list. The rest aren't part of fragrance ever or in the past, and so they would be standalone ingredients on the label.
Okay, these chemicals, because there are a lot of them, I mean, can they be grouped into something and then maybe on the label, like, you know, how you have gluten-free now or whatever, to where it'd be better to maybe put on there that, you know, this product does not contain, you know, and give a smaller definition so somebody, when they look at the label, they can see, okay, this product does not carry any of those dangerous chemicals in them. I don't know if that would be a better
There
way
is some
that the public could know.
Yeah, sorry to cut you off. I'm having
That's all right.
a habit of that with everyone in my life. Yeah, some of the products on here, there are, I believe, unregulated terms that are put on voluntarily by manufacturers to say, like, paraben free would be one example. Where it is referring to a class of things. But in that case, you know, the product still has to list all of the chemicals, all the ingredients in the product, any chemicals and anything else.
Okay, thank you.
My pleasure. We have Delegate Hill, followed by Delegate Bagno, followed by Delegate Barron. Delegate
Thank
Hill.
you, thank you. Delegate Carr, I appreciate this bill. I just, to Delegate Chisholm's point, we do pass bills all the time as states, not so much in this committee, but environment and transportation, that ban chemicals that are not being dealt with by the EPA, correct? So we ban things in Maryland that it might be better if the federal folks did. So this is not uncommon for us to be banning this, is that right?
That's right. And states certainly have their own ability to, there's nothing in federal law that prevents us from acting.
Okay, and I remember, for instance, some years ago, you all may be too young, when melamine was a problem in other countries getting into milk and contaminating. And so we can look at chemicals in our cosmetics and try to be sure that we're not contaminating. And I think of a product I bought once at a dollar store, some tampons, and then after looking at the sanitary napkins, decided I could not put something up inside of me because I was concerned about the chemicals that might have gone in it. So this would be a way of protecting me from a product that might be contaminated with things that we know are not safe. Is that the purpose of this bill?
That's exactly right.
All right, thank you.
And this is why it's in the Public Health Committee. And oftentimes public health is underfunded and we wait and wait. So this is proactive. Delegate Bagno.
Thank you, Madam Chair, and thank you for bringing this bill. Actually, I'm following up on Delegate Hill's rationale, because looking at the testimony from industry, it seems that this might actually be a beneficial bill, not just to ensure that we're not sort of trafficking these ingredients unintentionally, but also that we have the ability to advertise and provide consumer confidence if this bill passed into law. Is that fairly accurate?
Yes, I would agree with all of that. Industry definitely is supportive of this bill. They supported the California legislation. They are looking for, continuity across states, countries, and this legislation puts us in the same posture as other jurisdictions. And I do believe that the industry is trying to move in the right direction, and they just, want to be clear about what that is, and they are supporting this bill as it stands, plus the amendment.
Thank you, Madam Chair.
My pleasure. Delegate Barron.
Thank you, Madam Chair. I'm just
My pleasure.
want to make sure I understand the a manufacturer or someone selling or delivering or holding, they don't have to know that a cosmetic product contains any of these ingredients. Is that right? To be in violation?
Right. It would have to be, they'd have to have the knowledge that they were in violation for it to actually be a violation. If it was something inadvertent, if they bought some component for whatever they were manufacturing that had one of these chemicals in it and they were unaware of that contamination, they would not be in violation.
If they were, you're saying if they were unaware, if they did not know, then they would not be in violation?
That's right.
Because I'm not seeing a knowledge requirement in the bill. Maybe I might be missing.
So, I mean, I guess that's a fair point. As I'm looking at, yeah, towards the bottom of page 3 on here. I mean, I guess maybe the best thing I can say to kind of clarify on that is through these processes, like they are very aware of what they are putting in. Like these things aren't just, any of these chemicals aren't just being added accidentally. To the extent that any manufacturer is using them, they are being added purposefully. So the legislation does say, you know, if the manufacturing process was intended to comply with this and there was some inadvertent process, I would include in that C1, again, if there was some, you know, unknown contamination of one of their chemical elements in their manufacturing process, I would say that's covered under C1.
What about if we were to have, I mean, it just, and I might be reading
Delegate
it
Barron,
wrong.
if I may for a minute, are you
Yeah.
thinking about an amendment to clarify?
Yes,
Yes.
and I would have that amendment, I think, up top in, let's see, in B, in subsection B, on top of page 2, except as provided in subsection C, a person may not knowingly, you know, this some kind of, what's it called in law school? Scienter, mens rea,
Yeah.
you know,
Intent.
you know, knowingly or some such language, manufacture, sell, deliver, et cetera. I mean, it doesn't seem like there's any, I don't see any, there's not any like fines or anything for a violation, right? There's for this. Is that right?
This is just subject to the same fines and violations that exist in general for this section of the state code. I believe the violations are fairly de minimis. It's, you know, like $1,000 or something like that if there was a violation. But there's nothing specific for this bill. It's, you know, that's just writ large.
That's not what the fiscal note says. The fiscal note says 10,000 to 25,000 unless I'm reading it wrong.
And I'm sorry, I might be mistaken on recalling what the number is there.
Oh, so there are violations. They're just not, that section is not in the text of the bill. It's in another subsection.
That's right.
Okay.
They apply to many other sections as well.
Yeah, page 2 of the fiscal note says a person who violates any of these provisions is subject to both criminal and civil penalties. More specifically, a violator is guilty of a misdemeanor upon conviction, fine up to 10,000, and so forth. So Delegate Barron, the amendment that you would like to seek would be what you just described, correct?
Know or should have, or reasonably should have known, and that would be in subsection B.
Okay, so this is what I'm going to do. Delegate Palakovich-Carr, you don't have to come back. I'm going to hold the bill to allow Delegate Barron to draft an amendment with council, okay? And then we're going to meet and vote on the bill, okay? But, you know, Delegate Barron is the person, because I am in the annex, that is going to be defending the bill on the floor for my public health bills. He's going to do that favor for me. So he's going to seek that amendment and we'll, next time we meet, we'll vote on the bill. I don't want to, you know, ask you to come back again unless you want to. You're more than welcome. But we try to work it out in committee so that by the time we are in full committee, because we do work in a bipartisan manner, that we are, you know, we're going to vote on it, right? You take the vote up or down, but that you have been given an opportunity to raise your concerns and questions and address them. Okay.
Thank you all.
Thank you for your patience. So Delegate Barron, can you do me a favor? And I'm going to hold it and work with our council for that amendment, please, and make sure that Delegate Palakovich sees that amendment, all right? And
Yes,
send it
thank-
to the rest of the committee.
Thank you, Madam Chair.
Is
Thank you.
everyone okay with that? All right, wonderful. There's nothing else left for today. We were very thorough and we're finished. Next time we come, this bill will be on the agenda for a discussion of the amendment and a vote. Thank you so much for your patience, everyone. Thank you for your questions. It is 1:01. You have 29 minutes to have lunch. See you soon. Thank you very